Hi, I'm Dr. Sunil Richardson. I'm a maxillofacial and a facial plastic surgeon. I work out of South India and also the Middle East. So today we have a patient who's come for a follow-up, and this young handsome guy had an issue of a very broad nose. His tip was also very broad, and so we had to do what is called slimming the nose. We basically narrowed the nose. I've used a closed approach for this guy because we didn't need to do much anything else, and this is how he came to us. I think you can appreciate this. I'm going to first talk you a little bit about this picture. So the dorsal aesthetic lines are also a little bit bent. It's very broad. The tip is broad as well. You can see the date, that's 10th January when he came to us. This is before the lockdown, and he was not happy with the fact that the nose was too broad. And now moving on to his post-op, and you can see now that his nose is narrowed considerably. You can see the tip. It's got a nice looking tip. I've got the dorsal aesthetic lines fixed, and the nasal projection is also very nice. You can see that. You can appreciate how much it's projected. It's a straight line now. So we had to do osteotomy for him and narrow it down. You can see there's no scar visible whatsoever anywhere. உனக்கு ஏதாவது வலிக்கு இருக்குதா இப்போ? இல்ல. எவ்வளவு நாள் வலிச்சது இங்க இருந்து போற முன்னாடி? 5 நாள் இருந்தியா ஹாஸ்பிடல்ல? எவ்வளவு நாள் இருந்த? 5 நாள் இருந்தியா? 5 நாள். He was in the hospital for 5 days in all. So this takes a while to heal. So because we've narrowed down the nose here completely, you can see how nice the tip has come up. The dorsum, this is what we call dorsum, and this projection from the eye here should be a little over than a centimeter, so that looks like a nice projection. The next thing is this angle which we've given him. We've given him a nice straight nose because he's a guy. I've also reduced the tip. You can see how there's one pointed tip there, while here it's just like a broad tip. I mean, you can see the tip, very clear difference. This is a little bit bent nose, broad tip, lines are not clear. Here we're getting clear lines that come from the eyebrow on both the sides, straight nose, nice tip. And also we've given him a face that really matches his face, a nose that really matches his face. You can see the face shape, and you see this nose really looks broad. He's a young guy, but he's a smart guy, and he came to me with this main complaint, and his parents were like, no doctor, I think his nose looks perfectly well. So when we suggested that this would not be a very complicated surgery, so they were willing, and this is how he is at the end of the day. So the take-home message is, for some patients like this, when the nose is broad higher up, you'll have to get it narrow by working on the bone. We tend to call those lateral medial nasal osteotomies. This is combined a lot of times with a spreader graft, a graft that goes in the septum and the midline, and also a tip plasty. Tip plasty involves working on the cartilage, most of the times with a strut or a septal extension graft. Anyway, so these are only things that were done for him. And all of us were done was a closed approach. So you will not see any scar. You can just show close if there's any scar. Nothing to be seen. So there's no scar. So obviously I told you we did a closed approach. All right. Thank you.